Hello again, everyone. Dr. Dan Bachman here, and today it is, let's see, what is today? It's December 19th, 2021, and it's been quite a while since I've given you guys an update, so I figured I would check in with y'all and let you know what's happened, and a lot has happened since last time we spoke. So, first of all, still feeling great. I finished my 12 rounds of chemo. Those were around every 2 weeks, so about 6 months of that. That was the IV chemo using my port. And we're now on a regimen of, and I had my follow-up CT scans, which showed some more shrinkage in tumors in liver, and the primary colorectal tumor as well. Lung spots, we're not even sure if they are tumors. We're still not sure. They're so tiny. They're like 2 or 3 millimeters. So they could be just like, maybe you, breathe some dust and it scarred you in there or something a long time ago, and you just got a little scar tissue, and that's what we're seeing in your lungs. We don't know, but it's encouraging. So I finished the IV chemo. Now I'm on a regimen of chemo/radiation. So it sounds like it's the same thing chemo-wise, but it's not. Instead of IV, it's oral. So I take 4 pills twice a day, 5 days a week for 5 weeks. And I also get radiation on my primary tumor, which is the colorectal one, every single day for 5 days a week for 5 weeks as well. So 25 radiation sessions and 25 days of taking the chemo pills. And the weekends I have off. So I don't get any radiation, I don't get any chemo. So the idea here is the radiation is aimed at my primary tumor, my colorectal tumor, with the idea of shrinking it down smaller, which just means it's easier to cut out, there's lower risk, there's faster recovery time. In general, the smaller you can get a tumor, the way I understand it, the better. I mean, obviously it's not taking up a bunch of space in there, but it just makes outcomes better. And then once we do those 5 weeks of chemo radiation combo, I already have my surgery scheduled for my liver. I didn't even tell you. So I met with my liver surgeon too. But I have that scheduled, a surgery for my liver, February 8th, I think. February 6th or 8th. So here's how that came to be. So I now have 4 or 5 different docs on my team, all highly specialized. Colorectal surgeon, oncologist, who's kind of like the quarterback who oversees everyone and makes sure that everyone's getting the information they need. My liver surgeon, who works specifically with cancer. And my interventional radiologist, Dr. Herman. And I met with my liver surgeon for the first time a week or 2 ago. Super nice guy. I mean, I've been super impressed with all of these folks. Dr. Oxner, I believe his name is. So your liver, just for a little anatomy, it sits here on your right side of your sternum and underneath the edge of the lower edge of the ribs. It's the size of a football. So normally, everyone's, your liver, my liver. It's about the size of a football. It's surprisingly big. Now, I have 5 tumors in my liver. The shape of the liver is not like a football, though. It's got a fat end kind of on the outside, and then that tapers and becomes a skinny end that comes up across here. So you got a skinny and then it widens out. Now, 3 of my 5 tumors are in the little skinny bit right here. And 2 of them are in the big hefty part of the liver. So what they're going to do, by the way, there used to be 6 tumors, and over the course of my chemo, 1 of them disappeared completely. So that's interesting, right? So I was always wondering, well, are we just trying to get them small and hope they go away, or do they actually go away? Well, apparently they do, because 1 of them disappeared completely. So I'm left with 5. So the 3 in the small section, they're just going to chop that section off, and then they're going to go in with minimally invasive. They're going to try to do minimally invasive treatment of the 2 others in the big section because they're deeper in there. There's arteries and stuff. They don't want to, and it's easier for the liver to break. It can actually break as they're doing this stuff, crack as they're doing the surgery. So they're going to try to stick a filament in there with a little heating element on the end and just cook the tumors from the inside. That's what they're going to try to do. And I'm getting an MRI next week to look into that a little closer so they can get a better picture and so they know what they're dealing with when that happens. So they're going to be removing about half my liver. which I was kind of shocked that it was going to be that much. So you take football, cut it in half. That's what they're getting rid of. So I told my surgeon, I said, wow, 40 to 50% of the liver you're going to cut out. I said, it can grow back at least a little bit, right? He said, oh, yeah. I said, well, how long does that take for the liver to grow back if you cut out half of it? He said, about 2 weeks. I said, 2 weeks? That's crazy. I mean, that's like you could almost see it growing over that time to fill up that space. He said, yeah, it grows back really fast. In fact, we have some special tricks called I think it's called a hepatic vein embolization. So it's one of the main blood vessels that carries blood to or from the liver and to the liver, I assume. And they'll stick a filament in it that kind of blocks it off a little so that not as much gets into the big chunky part, but it all gets sent towards the edges of the part we removed, which just means it has super nutrient density there, and it regrows it faster. So we may or may not do that. Now, what he also brought up, which is something I was curious about, is what could we do my liver surgery and my colorectal surgery and my ostomy bag all at the same time? So really it's 3 surgeries in one. He brought that up himself, and he said, we can. He said, it's higher risk, and there's a little longer recovery, but you're just getting 1 surgery instead of, 2, I guess it would be. So he's going to bring it before the board of other oncological specialists who they all meet with and discuss my case and their other patients' cases, which I love about this group. It's Texas Oncology. They all get together once a week and go over everyone's case, all their patients' cases, or maybe just select ones, I don't know. But that way you get feedback. It's kind of like getting second and third opinions ongoing throughout your treatment course, which is amazing, because there's always going to be someone else in your same field or maybe a slightly different field is going to have a different perspective on some of these things. I mean, I know this from treating my own patients. So I feel really good knowing that these folks are all talking about me when I'm not here, and in the interest of figuring out what the best way to keep me alive and have it be a long, happy life is. So we got chemo radiation, got surgery scheduled early February. Side effects. So far, 0 side effects from the radiation. Now, I have 3 little X's that they're basically targets that they put on me. I may have showed you before. There's one right there. I don't know if you can see that. There's one on the outside of each hip. And they basically mark those spots so that every time I go in for radiation, every lunchtime, every weekday I go in, and it's only 15 minutes in and out, by the way. The radiation, I go in and lay in a CT machine and I mean, seriously, I walk in the door, maybe 8 minutes in the machine, and I walk out 15 minutes later. No pain, I feel nothing. Now, they said maybe halfway through this 5 weeks, I may start feeling some skin irritation around those X's, because that's where apparently they're sending the beams in to get to, they're kind of, I guess, hitting it from 3 different sides. And they said it might get a little, like a mild sunburn, maybe a little blistering around that area. So far, I have nothing. And from the oral chemo meds, they make me super cold when I take them, just like the IV chemo does. I mean, hands and feet just get cold, hard to warm up, but nothing other than that yet. They do say what they're expecting that I will get is palms of my hands and soles of my feet get really dry and cracked and painful. So it's amazing that, you trade one set of side effects for another. And now I will say, overall, way prefer chemo radiation to the IV chemo that I had. I mean, the IV chemo, I felt like I basically had a horrible hangover for a week. In addition to the neuropathies and the can't swallow stuff and brain fog. I mean, it was not fun. I could function, but it was not pleasant. Whereas now when I'm on chemo, I'm doing it 5 days a week. It's not that bad. It's not that bad yet. I'll knock wood here. I hope that it doesn't get worse, because my last chemo, the side effects got worse. They were like pretty decent at the very end. They spiked way up, and so we had to pull one of my meds. But anyway, so I think I've summarized everything. IV chemo and chemo, radiation, got surgeries planned. And then depending on if we do all 3 surgeries at once, it could be like 4 days to 7 days in a hospital recovery, and maybe 3 weeks recovery before I can go back to work after that. Takes a little longer to recover. There's more opportunities for something to go wrong. But he said because I'm young and otherwise healthy, that I may make a great candidate for that combo surgery. So, and if I qualify for it and feel comfortable with outcomes, I'd absolutely love that, because that's less time off work overall, and less times under anesthesia, and just seems like I'd like to knock it out if we can. And I got back in the gym. I kind of stopped for a while. I'm actually starting to regain some weight. So my normal weight before all this happened was about 192 pounds. I got down about a week and a half ago to 166. 166, 192. I mean, that's like 66, 76, 86. Yeah, that's over 20 pounds that I'm down. I've started gaining some back, so I'm up around 170, 171. Just from going to the gym a couple of times. I'm really packing protein in to my diet too, because I don't absorb as much of the food I eat. So you eat your food, it gets digested, and it gets absorbed by your gut. And that's how the nutrients get into the rest of you. But since my gut has been all beat up from the chemo, it doesn't have the little villi, which are the little fingers that are lining the wall of your intestines, and they create more surface area, and that just means more places where food can get absorbed. And chemo kind of kills that stuff off or damages it, so you don't absorb as much. So you have to eat more to get the same amount of nutrients in you. So I've been packing on more protein. I'm trying to hit 150, 60 grams a day. And eating well, staying hydrated, drinking over a gallon of water a day, trying to do something active every day. Probably doing that 5 days a week. So we're heading into Christmas, and got most of next week off. Looking forward to some R&R. And honestly, I feel really good. I feel close to normal. Bowel movements are not great. They actually got a little worse since starting the radiation, because it inflames things. It's baking the tumor in there, I guess. And I mean, but I'm still getting rid of everything every day that I eat, so it's not like piling up over days. So, which is nice, because I've been there too. So, again, thanks for all the well wishes. I really appreciate all of you. I wish all of you a wonderful holiday season, whether it's Christmas, Hanukkah, Kwanzaa, and New Year, whatever you celebrate. I hope you have a wonderful one and get to spend time with family. Be safe out there. I'm going to give you a checkup, follow-up. I'm getting an MRI coming up pretty soon, so I'll give you all results of that as well. And looking forward to seeing you all in the next year. Merry Christmas.